Hi, my name is Jordan, and today I am going to demonstrate how to insert an NG tube into our patient. So the first thing that we are going to do is we are going to get our MAR. We notice that Joseph Smith here has, for starters, no allergies and no sensitivities. And we see here in the order that he has got one for an NG to be placed because of some nausea and vomiting he's had over the night. So we are going to get that put in. So we gather our supplies. I got 2 pieces of tape pre-ripped over here. One for placement, one for once we get it positioned. I got an NG tube, a cup of water with a straw. We're using this just as an emesis base, and I would bring that in with me. Some lubricant, skin prep, some hand wash, some more tape, pH sticks, pad, pen light, tongue depressor, and a measuring tape, as well as a set of clean gloves here. So we've got our MAR, we've got our order, we are ready to head in, we've gathered our supplies. Hi, Mr. Smith, how are you doing? My name is Jordan, I am the student nurse on the floor today. We got an order to insert an NG tube in here today.
Okay.
Okay, awesome. Can I get a full name and date of birth?
Joseph Smith, 3/1/1968.
Matches our MAR, matches our wristband, and can I, any allergies, Mr. Smith?
None.
Awesome. Okay, wash my hands here. Okay, Mr. Smith, have you ever had an NG put in?
Nope.
Nope. Okay. Well, it is a tube that is going to go in through your nose and down into your stomach because you have been vomiting. And I know it sounds uncomfortable, and it will be on insertion, but we will do it fast, efficiently, and we will be done with the discomfort and on to the adding some comfort. It will end up benefiting you. So, you understand what we're going to do?
Yes.
Awesome. Okay, so the first thing I'm going to do is I am going to check my suction. I'm going to turn it on. And in this case, we're using intermittent suction at 100, which it's a little bit above, but right about 100. You want between 80 and 120 intermittent, and that is working. So Mr. Smith is in a high Fowler's position already, otherwise you would raise him into that position. So Mr. Smith, I'm going to take a look in your nose quick, and I just want to look for some occlusion. Okay, so I'm going to hyperextend the neck, and I'm going to take a look, and I know no occlusion, and then I'm going to check each nostril. I'm going to have him breathe through his nose, each nostril, and I note that the right nostril does have higher airflow, so we are going to use that one. Okay, Mr. Smith. All right, so first thing I'm going to do, Mr. Smith, is I am going to get our pad laid out. And today we are using a 14 gauge catheter, but if this were a child, we would use a smaller one. Okay, wash my hands. And I'm going to check Mr. Smith's gag reflex quick. And he does have a gag reflex, so we are good there. Okay, I washed my hands. I'm going to get some gloves on. Okay. Awesome. Okay, Mr. Smith, I will give you this emesis basin right away, and I will allow you to hold your water here, because we will be needing that, and I'll let you know. Okay. So, first thing I'm going to do is I am going to get a little bit of skin prep, and I am going to prep the nose. Okay. And while we're waiting for that to dry, we will get our NG tube out, making sure to check that the line is patent and there's no damage to it, which would be a brand new open NG tube, so hopefully there is none. So the first thing I'm going to do is I'm going to measure from Mr. Smith's nose to his ear, and then down to his xiphoid process. And without removing my hand here, I am going to mark the tube for placement so we know when to stop when we're inserting. All right, Mr. Smith, I am going to lubricate then our tube, but in this case it's been lubricated quite a few times today, so we are not going to lubricate it again. Mr. Smith has his water, he has his cups, so we are going to extend the neck, and Mr. Smith will also assist us with this, so we don't have to apply a lot of force here, but just help him to extend his neck. And we are going to insert to the oral pharynx, where we will feel a little resistance. We will then tip the head forward and have Mr. Smith start swallowing. And as he swallows, we will push forward 5 to 10 centimeters. Keep swallowing, keep swallowing, keep swallowing, keep swallowing, keep swallowing. And met a little resistance here, but we are there. Okay. And without releasing, we will place our tape on the client's nose, making sure that after the placement, if our client is on oxygen therapy, we will make sure to move his cannula around as appropriate or get him on some oxygen. Okay. The first thing we're going to do is we're going to get Mr. Smith an x-ray to check for placement, as well as check for respiratory depression. We could check residual, or we could check pH, which we want below 5.5, but at least 1.3 to 2.3 is about where it should be. And we are going to measure our external tubing every 4 hours for placement. Okay. How are we doing, Mr. Smith?
Good.
Awesome. So chest x-ray did come back, and we can now connect our tubing to suction. And we can remove this and some of our other stuff here we would have removed. And we could pin the rest of this to his chest here, to his gown. Keep it out of his way. Okay. Any questions for me, Mr. Smith?
Nope.
Awesome. Okay. I will remove my gloves, wash my hands, unprovide for privacy, and I will make sure to document the time, the date, the type, and gauge of our NG tube, our assessment findings, our x-ray verification, and that is how we will lower our client to a comfortable and safe level. And that is how you insert an NG tube.